Hi there, it's Dr. Matt Serrick here, chiropractor at Back and Balance Clinic in downtown Toronto. And today we're going to talk about some common evidence-based treatment options for patterns of low back pain. So stay tuned to learn more about the most effective treatments for common causes of back pain. In one of my previous videos, we discussed recognizing some of the common presentations of low back pain. But let's quickly review some of these patterns. So the first pattern is flexion intolerant back pain coming from the disc. The second pattern is extension intolerant back pain coming from the joints of the spine or the facet joints. The third pattern is flexion intolerant back pain with sciatica coming from a compressed nerve root. And the fourth pattern is extension intolerant leg dominant pain coming from spinal stenosis. Many of these patterns of back pain will demonstrate a directional preference, meaning that moving the spine in certain directions will feel good and in other directions will aggravate the complaint. For pattern 1, the most effective treatments are a short course of medications such as acetaminophen and NSAIDs, adopting positions of relief to take pressure off of the disc that can include the Cobra position or McKenzie protocols, light aerobic activities such as short, frequent walking. You would want to avoid prolonged activities in a flexed position, such as sitting or driving. And if you are in these positions, an extension roll might be useful. And once the pain is under control, it is important to address any underlying muscle dysfunction or imbalances through focus exercise. For pattern 2, the most effective treatments are short course of medications such as acetaminophen and NSAIDs, forward flexion-based exercises since extension positions are aggravating, for example, the happy baby pose. Sitting or standing with a footstool to create more lumbar flexion can help take some of the stress off of the joints of the spine. You should try and reduce backward bending motions or reaching high above your head, as this can irritate the joints in the acute stage. Once pain is under control, regular exercise targeting the major back and leg muscles can help improve function to get you back to pre-injury levels. For pattern 3, the most effective treatments are a short course of NSAIDs with the option of stronger pain medications might be needed in the acute stages. If the first line of acetaminophen and NSAIDs do not work, ask your family doctor about medication options. Epidural steroid injections may be considered in severe cases, and you should speak with your family doctor. A ZAD lie position may be helpful to produce some short-term pain relief. Light aerobic activities such as walking within symptom tolerance can help. And sometimes even a wait-and-see approach might be useful until the pain actually calms down. Once the acute inflammation does calm down, regular exercise, including something called neuromobilization, may be helpful in addressing some residual symptoms. For pattern 4, the most effective treatments are a short course of medications like NSAIDs or acetaminophen, avoidance of prolonged extension positions, and an adoption of more flexed positions during activities like walking and standing. When walking, using a walking aid that allows for a more forward flexion can help reduce symptoms and take sitting breaks as needed. There is also stenosis-specific rehabilitation programs such as the Stenosis Boot Camp, which is a series of exercises designed to help with spinal stenosis. These are some of the common treatment options for the various patterns of back pain. As much as we'd like to simplify it for understanding, everyone's a little bit different, and there is unfortunately no exact cookie-cutter approach for everyone. If you are experiencing back pain, get it checked out by a trusted professional who can guide and coach you on the best way to manage it.